I think each case is interesting, but yes, there were one or two really, disturbing episodes where there were bad lacerations across the face or the neck. You were literally worried,
Making a career decision can be very intimidating. I understand that. Been there, done that. But at the same time, it is very important for your career growth. And coming to NEET MDS counseling, yes, there are so many uncertainties, anxieties which come along with it because there's so many branches and you get confused about which branch to choose and how to choose it. So let me quickly introduce myself. I am Dr. Ichita Joshi and I'm your host for this show. And with that, I welcome you to another episode of Tooth Talks, Navigating Your Dental Journey. Before diving deep into the show, let me take a moment to quickly thank Cuspyd, whose support makes this show possible. So Cuspyd is an evolving EdTech company who are putting in lots of efforts to transform the way in which dental professionals learn and grow. So they are out there to help students like you through technology and fun content. With that, I would like to welcome our guest who will be sharing with us all the wisdom and knowledge so that you can decide and you can get an inside scoop about the branch of oral and maxillofacial surgery. So, welcome to the show, sir.
hi.
So, our guest is Dr. Ramana Reddy, sir. So, sir is currently the Dean of Malla Reddy Institute of Dental Sciences. And sir has done his BDS and MDS from Government Dental College and Hospital, Hyderabad. And sir has also done his FDS RCS from England and FFT RCSI from Ireland. So we're glad to have you here for this session. And I'm pretty sure your knowledge will tremendously benefit all the dental students out there. Sir, I'm very curious to know about what ignited your passion for oral and maxillofacial surgery? Did you always want to become a surgeon?
It's funny actually, as a kid, I think I was dreaming to be an orthopedic surgeon. I think I'm a default dentist, and I think somewhere down the lane I saw a surgery in my college, and then made a instant decision. Yes, I want to be a surgeon. Okay. So yeah, that's how it started. So there is some small episode which will tickle you or incite you, and then you make a decision. So I was seeing a surgery being done under general anesthesia in Usmania General Hospital, where my teacher and PG guide, Dr. B. K. Reddy, was doing it. And then, so it was a small surgery, but nevertheless, that sparked me that yes, I want to be a surgeon.
Okay, sir. So now I think you are destined to be a surgeon. That's why you're here as a successful oral and maxillofacial surgeon. So, sir, coming to that, I would like to ask you more about this branch. What is the scope and how does the life look like after one passes out as MDS in oral and maxillofacial surgery, and what are the job opportunities which are there?
I think I'll put it differently. I think the field of dentistry and other specialties are also changing. So you shouldn't look at specialty wise. And I think surgery, yes, it is one of the specialties where it gives you a wide experience to all the different surgeries you're exposed to. It will improve your confidence and in handling cases or doing the surgeries. And you're actually a better dentist, better doctor, and better surgeon. So yes, I think always we have started dreaming ourselves to be as doctors, and then this is a nice specialty where you are bridging the gap between dentistry and surgery. Luckily, surgery is a single degree specialty. If you're on the other side of the globe, you would require a medical degree. Luckily, it's still a single degree course here, and you are exposed to the full spectrum of surgery. And a lot of our specialist surgeons have actually extended the scope of surgery from maxillofacial to even craniofacial and all. But once you decide to become a maxillofacial surgery, it doesn't stop with your PG. It goes beyond, and it's a long training process, and you may have to again work with some hospital or some senior surgeon and subspecialize before you actually establish yourself. But it gives you a good grounding in your general dentistry, general oral and maxillofacial surgery. and your confidence levels are high. And you see that in any college, if there's any medical problem, usually they rush to the surgery department.
Yes,
Yes.
surgery
So,
people will be called for that.
yeah. So, so we are proud of that. And then that is what makes the difference. And after you do your surgery, again, there is nothing stopping you. You would have been more mature or experienced enough to again decide what further you want to do. So it's a foundation at a postgraduate level where it will take you to the next best step which you have in mind.
Okay, sir. Sir, as you were mentioning about further degrees that you have to do after doing MDS, can you tell us about these various fellowship courses that we keep hearing about?
I think there are good thing is oral and maxillofacial surgeons of India themselves have come out with various fellowships which is not there before. So one of the reasons we went abroad was we didn't have those options. You have trauma fellowships, you have orthognathic fellowships, you have even cancer fellowships, and they're giving you a very good exposure and confidence, and a good structure training is there, and with very senior and established hospitals which partner with the association. So these are definitely there in India as well. And then there are a lot of organizations or opportunities where probably you can expose yourself to even some places in abroad. So, but now I think you don't even have to go abroad. There are very good opportunities which are available.
Okay, sir. Sir, you've told us a lot about the scope and the job opportunities which are there, and also the fellowship courses which are available. So, coming to other sorts of procedures that you do, can you tell us more about what all is taught in the curriculum in first, second, and third year of MDS in oral surgery?
Curriculum is as per the DCI, but what actually happens will vary from the institute to institute. So it is, the faculty led or the people who are trained. So some institutes are probably strong in cancer, some are strong in trauma, some are strong in orthognathic surgery, but you may not get everything under one roof. So you have to be very, very choosy where you're wanting to go. So, and again, even in countries where I was exposed to in the UK, so you may be exposed to a lot of other things, but again, they specialize, and then probably in a unit, they will not be doing the full spectrum. Maybe they may be doing cancer, or they may be just doing orthognathic. But again, trauma is the central part of maxillofacial surgery, and we have a fantastic exposure, confidence, and outcomes which are deliverable by the maxfac surgeons in India and abroad, and wherever maxfac surgeons are.
Okay, sir. Sir, you have mentioned that you have also taught in so many private colleges. You've been a professor there and head of the department, and you have yourself completed your BDS and MDS from a government college and also been a professor there. So, can you tell us any difference between government college and private college when it comes to this department, oral and maxillofacial surgery?
The way the hospitals are run, it's the different dynamics. Government hospital, yes, you have a huge outpatients and a variety of cases. But again, there are certain shortcomings with regards to the deliverables, because of the huge patient load. But it's really a humbling experience for me personally, because you're more grounded, more humanistic in your approach. Whereas in the private colleges, yes, there is good scope which was not there during our time. So an opportunity is provided for everybody, and sometimes they have better facilities, and they also have good enough patients, and good expert faculty are available. So it's about bridging the gap for what the society needs, and that is where the private colleges are bridged in. So I think surgery, specifically, if we see, it is each institute has its strengths and weaknesses. So the students should look into that before they take a decision. But overall, I think in Telangana, I think most colleges, have been headed by maxillofacial surgeons. So maxillofacial surgeons are passionate, and they take their profession seriously, and then they have made a name for themselves.
So, sir, I totally believe that you people are doing a very noble job, and by giving your service to the people. And that definitely gave me some clarity about private colleges versus government college. I think both are coming at par at this current scenario. But coming to one doubt that I have is there are so many overlapping procedures that you have with some other medical specialties, for example, ENT or something. So, what is it that makes the oral surgeon stand out in such a case?
The delineation is not very clear here because whatever regulations or whatever policies are there, it's very clear abroad. So if somebody is having a maxillofacial problem, they go to a maxillofacial surgeon, and the other specialties know what they have to do, and then they deal with that. So here the overlap is quite huge. But once it comes to maxillofacial problems, we have studied the anatomy as well, equivalent to the medical graduates, and then the fundamental thing in whether it is cosmetic or anything to do with trauma is fundamentally is the occlusion. So everything revolves around that. So the functionality part is very important. So we made a difference, and then our patients know. Then world over published literature is there as to what maxillofacials have done. So the delineation may be very unclear here, but the work speaks for itself. So all of my colleagues, whether it is in Hyderabad or wherever, they made a name for themselves, and then people ask for maxillofacial surgeons by name. But yes, we need more exposure, more PR exercise, and which our association is doing and which we ourselves are doing in our practices on a day-to-day basis.
Yes, sir. I agree to that. All your oral surgeons are putting in a lot of efforts to make the specialty even more vast and to increase the scope of it. So, sir, my next doubt is something which is coming from a BDS student, I would say. So, if I'm a BDS student and I'm not very sure about my extraction skills, or I believe that I'm not good at such procedures. So, can I still take up MDS in oral surgery? Or should I just hold back from that?
No, you wouldn't take a surgery just for improving your basic surgical skills. And I think you have to, that can be incorporated in the regular BDS curriculum. And but unfortunately, yes, because of various dynamics which are market driven, that is not happening. But for basic surgical skills, yes, I think within the undergraduate curriculum, or these days, there is a huge shift in the training also. You have a lot of courses which can actually teach what is not being taught or what is being left out in these colleges. So these are very simple, I think, extractions or simple problems, whether it is suturing or basic medical emergencies or anything like that. So you can probably work with a surgeon and then pick up those few skills.
Yes, sir.
Wherever I have worked, I've seen that undergraduates are not left out, and then they're confident enough to take whatever jobs they are.
Yes, sir. So I think that is a very big relief for any undergraduate student, who's kind of skeptical about it. Should I join or should I not join? So for such a budding oral surgeon, is there any advice, golden advice that you would like to give, or any tips for getting those stable surgeon hands?
Yeah, I think it's a process. I think each one, having chosen to be a surgeon, you will evaluate your strengths and weaknesses. Try to choose good mentors, the right places where people sometimes will handhold. Sometimes not everybody has the guts to take. It's just not about guts, but it's also a lot about common sense. So in the words of, I think there's a famous surgeon, I think it's a UK surgeon, Kirk. So it is all that small steps which you do will make a big surgery. So people should know that all the single small steps are equally important as the big surgery. And it's a learning process which everybody will learn. So I think dentistry per se, or any medical specialty per se, will take a long training times, settlement time. So patience is very key. So which I think we are inbuilt. I think we are born for that, and then we take it in our stride. So this has to be reinforced and consolidated so that you actually establish yourself as a dentist and then a surgeon and then obviously, as a good doctor.
Yes, sir. I agree to the fact it takes a lot of passion and hard work to become a dentist and then a specialist in that. So, sir, it was really nice hearing about all the technical stuff from you. And I'm sure our students got a great inside scoop about the branch of oral surgery. So, sir, leaving out all the serious part aside, I would like to ask you some fun questions. Like, we are really curious to know more about you. So, sir, to start with it, can you tell us any coolest surgery or some interesting surgery that you've done so far?
I think each case is interesting, but yes, there were one or two really, disturbing episodes where there were bad lacerations across the face or the neck. You were literally worried, will it come into place? And then you start and then put things together, and then you're surprised as to the before and after pictures. Yes, I think some of the trauma cases, especially bad lacerations or bad trauma cases, everything is a haywire, and then so you put it together, and then each case is a good experience. So yeah, I love doing that. Yeah.
Okay, sir. Definitely, sir. Especially when it comes to trauma cases, you people are changing lives, and I would say actually giving new life to that patient. So it is something like God's work being done by you people. So as you were mentioning, sir, that oral surgery branch chose you. So I'm really curious to know, if not an oral surgeon, what you would have been in life.
So I keep telling my students, I think I wouldn't. Yes, I would be probably in some other part of medical or dental profession. So given another life, I would do the same thing. I love teaching. I love being with my patients and being there to help out. And I enjoy the role which I play. I can play it again and again. So no doubt about it. Maybe in a different role, maybe in a different specialty. Yes, in the whole spectrum of medical and dental.
Okay, sir. So your passion for dental and medical sciences has really been projected very well through your answers, and that is really inspiring to know. So I'm pretty sure sir's answers and all the knowledge that he shared with us inspired a lot of you budding oral surgeons. So thank you so much, sir, for having this session with us. It was definitely an honor to have you here. And we have a small hamper for you. So thank you so much for coming to this show.
Thank you. It's been great being on the show. Enjoyed it.
Yes,
Thank you.
definitely.
Bye-bye.
So to all the people who are watching us, to all our viewers, I would like to say, do subscribe Cuspyd's YouTube channel, because they are putting out some great content for you all. And also we want to hear from you. So do drop a comment in there telling about your doubts and queries, or which guests you want us to interview. And don't worry, Team Cuspyd will get back to you. So see you in the next episode. Take care and have a good day.